Dr. Miller-Meeks for 5 minutes to speak on the AINS.
Mr. Chairman, I move to strike the last word. Thank you, Mr. Chairman. I'm proud to see the Energy and Commerce Committee marking up the SUPPORT Act, which has had tremendous impact on opioid and mental health epidemic in America. And let me also say that the number of overdose deaths reached their zenith under the Biden administration. And in fact, let's be true to our words and stop saying things like, some people are trying to gut Medicaid, which we know is not happening and is not true and is a myth. So having said that, I'd like to highlight a bipartisan initiative I've been working on for 2 years to complement this bill's efforts. According to the CDC, we lost more than 110,000 Americans to drug overdose deaths in 2022. It's estimated that 75% of these deaths involved opioids, meaning that 226 Americans died every day to opioids. While many cases of drug-related deaths are poisoning, where the individual does not know that the product they're about to use is laced with another substance like fentanyl or synthetic fentanyl, more needs to be done to prevent addiction, including minimizing unnecessary exposure to opioids. 90% of acute pain patients receive opioids to manage their pain, whether or not they need them. Between 2011 and 2019, opioid prescriptions decreased by 40% from approximately 250 million to 150 million prescriptions dispensed. This is true across most payer audiences, Medicaid, private, and cash payments. However, among Medicare patients, opioid prescribing has actually increased. Furthermore, Medicare's share of opioid prescribing during this time has increased substantially from approximately 20% of the country's opioid prescriptions in 2011 to 35% in 2019. This represents a 75% increase in just under a decade. We clearly have work to do in Medicare to make sure that patients have access to effective pain relief agents while also not unnecessarily exposing them to narcotic painkillers. One way to do this would be to increase access to non-opioid pain management medications or other entities, which I'm seeking to accomplish with my legislation, the Alternatives to Pain Act. This legislation, which I thank Congresswoman Berrigan for co-leading, would decrease barriers to accessing non-opioid pain management alternatives that are FDA approved. I ask that the chair commit to working with me on this legislation to continue the great opioid use reduction work this committee has accomplished. I fully support the SUPPORT Act, and thank you, Mr. Chair. I yield back.
Would the gentlelady yield?